Did you know there's another way to become a dermatologist without going through the traditional specialist training route? Today, we're going to deep dive into the portfolio pathway, formerly known as the CESR route, and how it could be your ticket into dermatology. So, if you're probably watching this, you're probably exploring all your options to break into one of the most competitive medical specialties. So, let's break down everything you need to know about this alternative pathway. So, what is the portfolio pathway route? It's essentially a way for doctors to demonstrate they have equivalent competencies to those who completed traditional specialist training, but they've gained these skills through alternative routes. Think of it this way: instead of following the standard curriculum pathway, you're building a portfolio of evidence that proves you have the same knowledge, skills, and experience as someone who went through conventional training. Now, the key word here is equivalent. You're not taking a shortcut, you're taking a different route to reach the same destination. The GMC will assess whether your combined experience, training, and qualifications match what they'd expect from a traditionally trained dermatologist. This route is particularly valuable for doctors who may have gained dermatology experience in non-training posts. So why choose the portfolio pathway route? So there are several compelling reasons. First is flexibility. Traditional specialist training follows a rigid structure with set rotations and timelines. With the portfolio pathway route, this allows you to tailor your experience to your circumstances and interests. Maybe you've been working in dermatology research or you've gained experience in a particular subspecialty. This route lets you leverage that unique experience. The second point is that getting into dermatology specialist training into the area that you want to go into is actually really competitive. You may get into dermatology specialist training, but you may be relocated to Aberdeen when you wanted London. And if that means shifting your whole entire family to go to Aberdeen to finish off your dermatology training, that might not be practical or feasible for you. So you may get an opportunity to do a clinical fellow post in London, and you can build your portfolio pathway in that clinical fellow post. Third, it can be faster in some cases. While traditional specialist training has set timeframes, if you've already have significant dermatology experience, for example, you've did a number of years in a clinical fellow post, you may be able to get into consultant level more quickly. Okay, so how do you become a portfolio pathway doctor? A portfolio pathway route requires meticulous planning and documentation. First, you need to map your experience against the dermatology curriculum. The GMC has identified 7 specific capabilities in practice, or SIPs, that are unique to dermatology. These are SIP 1, outpatient dermatology experience; SIP 2, acute and emergency dermatology; SIP 3, medical dermatology, diagnosis and management of complex medical skin conditions; SIP 4, pediatric dermatology, so specialist care for children with skin conditions; SIP 5, dermatopathology, so microscopic diagnosis of skin diseases; SIP 6, dermatological surgery, so you need to show that you got your surgical procedure signed off; and SIP 7, community dermatology, so that's dermatology care in community settings. You'll also need to complete your MRCP UK or a comparable assessment, plus evidence of internal medicine competencies equivalent to IMT2 level. Beyond the core SIPs, you'll need to gather evidence across several key areas such as clinical experience, direct patient care demonstrating competency in all 7 SIPs. So the curriculum requires breadth across medical dermatology, surgical dermatology, pediatric dermatology, and dermatopathology. If you do want to become a consultant through the portfolio pathway route, you would also need to complete your dermatology SCE. I've done a different video on that if you want to check that out. You'd also need to show that you can teach and you can train other students or medical students, and you need to get teaching observations signed for that. And you also need to show that you've done audits and quality improvement, showing you can evaluate and improve dermatology services. And then once you've got all this evidence, you need to submit a detailed portfolio to the GMC online. You'll assess whether your combined experience is equivalent to traditional specialist training. And I would recommend to actually buy the NHS e-portfolio to collate all this evidence, because as specialist trainees, we use the NHS e-portfolio. So collecting these assessments may take several months, And it's important to note that at least 80% of your evidence should be from the last 5 years of clinical practice to demonstrate currency of skills. And it's so crucial to seek guidance early. Many successful portfolio pathway doctors work with mentors who help them identify gaps in their experience and plan their career moves strategically. In our deanery, there is actually a separate group for portfolio pathway doctors who are doing dermatology. The British Association of Dermatologists actually provides specific guidance for portfolio pathway doctors, and they do actually hold courses for this as well. So do check out their website. Entry routes to dermatology training have also been updated to include core surgical training with 12-month internal medicine experience, which can be relevant for portfolio pathway candidates. So what are the advantages of going through the portfolio pathway route compared to the traditional specialist training route? So the biggest advantage is flexibility. You're not constrained by the rigid structure of traditional training programs. You can pursue opportunities that align with your interests and circumstances. For example, if you are in a hospital which is close to your home and you like the team there and you're able to gain a lot of dermatology experience, portfolio pathway route may be better for you compared to the traditional specialist training route. If the traditional specialist training route is difficult for you in terms of location, rotation, and time-wise as well. Faster progression and relevant experience. Rather than starting your trainings from scratch, you can potentially reach consultant level more quickly, especially if you've got a lot of experience under your belt. Finally, it allows for subspecialty focus if you developed particular experience in an area like dermatopathology or pediatric dermatology. The portfolio pathway route can recognize this and can build that on specialized knowledge. However, there are disadvantages and challenges to the portfolio pathway route. The biggest hurdle is securing appropriate experience. Without structured placements or traditional training, you need to actively seek out dermatology opportunities, and this can be particularly challenging given how competitive dermatology posts are. And documentation requirements are extensive. You need to meticulously record and evidence every aspect of your experience. This requires excellent organizational skills and forward planning. And there's less support structure compared to traditional training. You don't have the built-in supervision, teaching, and peer support that comes with formal training programs. And the assessment process can be unpredictable. Unlike traditional training with clear progression milestones, because we have ARCP every year, with a portfolio pathway, this can be subjective and you might face requests for additional evidence or experience. Financial implications can be significant. You might need to fund additional courses, conferences, or even work in lower paid posts to gain necessary experience. There's also potential for longer timelines than expected. While it can be fast in some cases, many portfolio pathway candidates find the process takes longer than anticipated, especially if gaps in experience are identified. It may be difficult to find a consultant to support you through your portfolio pathway route and get your procedures or your workplace-based assessments signed off. So you really do need a supportive team in dermatology. So yes, the portfolio pathway is a viable alternative pathway, but it requires dedication, strategic planning, and resilience. It's particularly suited to doctors who have already gained some dermatology experience and are willing to take a less traditional approach to career development. If you are considering this route, my advice is to start planning early, seek mentorship, and be prepared for a journey that requires self-direction and persistence. It's not easier than traditional training, it's just different. Remember, whether you choose the traditional specialist training route or the portfolio pathway route, the goal is the same: becoming a competent dermatologist who can provide excellent patient care. And if you want to know more on how to become a dermatologist, I actually did a video on this, which you can check out somewhere on the screen.